But let's talk a little more kind of like, so you moved to Springfield, you're a very active outdoorsman, right?
Right. And I take 2 to 3 weeks a year for deer hunting that I take off on vacation. Late October, November, like all the nurses in the OR, they know that they don't see me. I'm just out in the woods up in the tree. I'm just watching wildlife and stuff like that. And I've always had symptoms related to just gastrointestinal trouble. And thought I had irritable bowel symptoms. I went to my internist. We did CAT scans, ultrasounds of the abdomen, finally HIDA scans. Finally, 3 years ago, had my gallbladder taken out. And that seemed to relieve some of my symptoms because it happened with eating steak, eating ham, like fatty meals like that at once. A couple episodes, I get my hands and my feet would start to like get an allergic reaction, like they were itchy, and I'd take Benadryl and they'd quickly go away. And once I had the gallbladder out, things were going okay for a while. And then the past year, I thought I might have been lactose intolerant. And one of my children's lactose intolerant, and when I was trying to figure out why do I not feel well, I was kind of pinning it to some of the dairy, but I noticed that when I'd eat steak, I still didn't feel right. Just had an upset stomach and just felt just not right. And so here in the middle of October, my one daughter was going back for the weekend, go back to college, and we had steak with her. It was a Sunday afternoon. About 2.5 hours after I ate the dinner, I started to notice I started to get hives on my arms. And I thought, geez, that's weird. About 80% of my body was covered in hives. So I had this itchy burning sensation, and then ended up with severe GI symptoms. So that lasted for a couple hours, and then I went and I started to get chills, like I had an infection. So at this point, I called one of my ER doc buddies.
Because, it's got to be pretty scary at this point,
right? And you just feel like something in your stomach, your chest, and your neck, just something's not right. And so I talked to the ER doc, and I said, I told Chris, I said, I think it has something to do with the steak. And I said, if things don't get better, I'm going to come into the ER. Turns out things subsided. After about 6-7 hours of it, I went to bed after midnight. It was probably 1 in the morning, woke up at 5, hives were gone, so I went to work. And that next morning, my buddy Chris, the ER doc, had texted me something about alpha-gal syndrome. And I had never heard of it before. And I read what he had texted me, and I think it might have even been from Mayo Clinic, what they mentioned about it. And I thought, man, this seems like me, because it's a meat allergy that you can obtain from a tick bite. And so about a month later was the next time I had beef. I was able to eat pork okay, but my wife had made this delicious meal that included some beef patties. Well, 2.5 hours later, I'm on the computer, and I start getting hives again. And this is the night before gun season, and I never miss first gun season for deer. And finally get to bed about midnight and get up at 3:30 in the morning just on my own, before the alarm, and I just felt terrible. So I didn't even hunt. So I went on a Thursday to Barnes, saw the allergist there, and as soon as I told her the story, she said, yeah, I think you got it. She says, I have a bunch of patients who have this in southern Illinois, southern Missouri, and she was all excited. She said, we'll have the results back in 2 days. And I thought, well, yeah, they have them back in 2 days because it's Barnes, it's a big hospital, they do them on site, and boom, they're gonna have them. And here I go, and in 2 business days, I get the results on the computer. It says alpha-gal IgE 15.7, but it says Dr. William Maurice, Mayo Clinic Laboratories. So I send him an email like the next day or whatever. I'm like, dude, why in the hell couldn't you help me out, And, but seriously though, when you see that, and I'm like, why do they not, you have a place, Barnes has almost 1,300 beds in its facility. It's a major tertiary medical center, and why don't they do the test? But when I saw that it was done so quickly, and 2 business days for your institution to get the results back, that's amazing.
Yeah.
But having been at Mayo and having been out in the real world, I kind of get it.
Yeah.
Because you see the difference with the Mayo product versus the rest of the world.
Yeah. Maybe we go ahead and play the video and from Dr. Bornhorst about the testing.
So alpha-gal or alpha-galactose allergy is an allergy where a patient develops antibodies against alpha-gal, which is found in mammals that are not human, most notably cows, so beef, and pigs, pork. If you develop antibodies against this molecular component alpha-gal, upon eating beef or pork, you may get a delayed response in that 4 to 6 hours. You'll get an allergic reaction, and that can range from hives, it can range to abdominal pain, it can result in anaphylaxis, it can result in vomiting. So it's a broad spectrum of the diet of many people to eat red meat. So it's distressing for those who develop it. You become infected predominantly by being bitten by a tick. So a tick will bite a non-human mammal and then essentially regurgitate blood back into a person. And then that person can develop antibodies against the red meat component alpha-gal that's present and transferred by the tick. Most typically this is in the southern U.S., southeastern U.S. with the Lone Star tick, although there are other vectors and there are unknown vectors, so there may be other insects that may also result in this allergy being developed in people who have become sensitized. So somebody who has kind of a broad spectrum of allergy against red meat might consider this, especially if there's a delayed reaction and a history of tick exposure in a geographical location that's compatible with alpha-gal syndrome. This testing is performed by a high throughput instrument that looks for antibodies against alpha-gal. So if you do have those antibodies, it can measure the level of those antibodies, and the degree of sensitization correlates with those levels of antibodies, although notably sensitization does not equal allergy or severity of allergic symptoms, although it correlates. There is alpha-gal that is placed on a filter, and then in the patient, when the patient's serum is introduced to that filter, if there are anti-alpha-gal IgE antibodies in the serum, they will bind to that filter and then be detected. So Mayo Clinic was one of the first labs in the U.S. to adopt alpha-gal IgE serum testing, and due to the large volume of reference work that Mayo Labs does, we are able to maintain that assay. Sometimes it is paired with red meat, food allergy, IgE or antibody testing as well, together with clinical history, sometimes skin prick testing, which is done by the clinician. All these factors come together to play a role along with alpha-gal antibody testing in diagnosing this disorder.
So, I mean, you're a doctor, right? A Mayo Clinic trained physician, and it took you a long time to figure this out, right? So,
well, yeah, and they say the average length to diagnosis with alpha-gal patients is 7 years. And they say people get exploratory labs, they get their appendix out, they get their gallbladder out. I got my gallbladder out.
Yeah.
You know, because people, and I talked to the gastrointestinal docs, other people, nobody knew what I was talking about after I came up with the diagnosis.
Yeah.
And so that's why it goes unnoticed.
Yeah.
So
it's part of our whole mission is to really educate, right? To make the testing available, but to continue that mission of educating the healthcare community about these things, right? And why the testing is important. I mean, it's you got your answer in 2 days, and it pretty dramatically altered your life in many respects, I think, right? I mean, how have things been since you got the diagnosis, I guess?
I mean, it's been totally different for me from a dietary standpoint because I'm a vegan now I can eat fish and fowl. So I eat chicken and fish, and then the allergist at Barnes thought I could go back to dairy because meat is a high risk, dairy's moderate risk, and things like marshmallows, Jell-O are the lower risk things, gel caps that you see on medicines. But I decided, I thought I had issues with dairy before, I've avoided that totally, and this is the best I've felt in I don't know how long, related to my GI tract. The biggest adjustment for me is gonna be with the hunting because with alpha-gal, a gentleman who's done more alpha-gal stuff than anybody is from North Carolina as far as seeing patients. He said 30% of his patients are able to eat meat again within 3 to 5 years, but the caveat is those patients are usually ones who don't spend any time outdoors.
Yeah.
Alpha-gal patients have a 30% higher cardiac risk of having an MI because the plaque that they form in their coronary arteries is more unstable, has more calcium in it. They think it's because of the constant inflammation and the immune system being in overdrive. And so I have to talk to my doctor and maybe a cardiologist and see if I need to be on a statin or an aspirin. I've been doing the bike, Peloton, been exercising more, so I've been eating healthier, and just as a result of that, and you could get kidney issues with it as too.
Yeah.
Inflammation or disease related to the kidney, because alpha-gal tends to focus more in the kidney than anywhere else.
Yeah. So I guess kind of in closing though, just that when you saw, could you just kind of share, because you shared with me and it was really powerful, you know, just once you got over the shock of seeing my name on the report, but just kind of your experience in getting that test and knowing that test was from Mayo Clinic.
As soon as I see your name and Mayo Clinic on there, I have no doubt that it's an accurate test, and I think, okay, we have the answer. Now, how do I focus on getting the best out of my life and, you know, beating this and trying to educate those around me too? And because there's a lot of people out there that probably have symptoms and they just haven't been diagnosed with it.
People come to us for answers, right? Sometimes they come into the ER and end up on a service, and there's a first-year resident like you or me, probably a little better. The quality's continue to go up. That's helping them with that. But sometimes it's a specimen coming into Rochester, right? That we got to turn around quickly and get back to patients, and it really has a meaningful impact, right? That it is from Mayo Clinic.
Oh, for sure.
Yeah. Well, it's great catching up with you. Thank you so much for sharing and being willing to share and being willing to fly in with your lovely wife. It's great to catch up with you, and it's really, it's energizing, re-energizing for all of us to hear that you have this experience and your willingness to share it. So thank you.
Yeah, thanks for letting me share my story, and I appreciate your work. Yeah thank you.